Okay, so good afternoon. Um, our topic today is care in medical imaging and radiation therapy. So it is written in your um, course outline na nakalagay sa inyong CMO or the new curriculum, itong care in the medical imaging and radiation therapy. And upon checking, this topic is about a particular legislation, not in the Philippines but in the U.S.A. So I don't know what's the reason why the CHED included this in your curriculum, but it is a nice information or additional information for us, RadTechs and soon to be RadTechs here in the Philippines, what is the situation of imaging professionals and radiation therapists in the US. Okay? So at the end of this presentation, students will be able to explain the background of the CARE Act of 2013, discuss the nature, issues, and reason why the CARE Act is promulgated, list and expound the benefits of the said legislation, exchange thoughts on how the legislation may apply in the Philippine setting. Okay, so first, let us define CARE. Actually, CARE is an acronym which means consistency, accuracy, responsibility, and excellence in medical imaging and radiation therapy. So ano kaya yung nilalaman nito ng batas na ito? So later di-discuss natin kung bakit kinailangan na magpasa ng batas na katulad nito ang Amerika at ano ba yung pinaka-content ng batas na ito. So, isa sa mga reason kung bakit ito ay ipinasa para amyendahan or i-update at the same time, i-enforce, ipatupad yung Consumer Patient Radiation Health and Safety Act of 1981. So, 1981, tapos 1991, 10 years. 1991 to 2001, so 20 years. So, ilang years na lumipas, mahigit 30 years bago nila ma-amend yung batas na yon. So, as we all know in your di ko lang sure kung na-discuss nyo pala to sa introduction to RadTech ninyo nung first year that imaging professionals in the US are different from our practice here in the Philippines. If you are a RadTech here in the Philippines, you are qualified to handle the different modalities that are written in the RA 7431, such as ultrasound, nuclear medicine, CT scan, MRI, and other modalities or machines with use of radiation such as bone dosimetry, lithotripsy, and other more. Okay? In the US, if you qualify only or you took an exam only for general radiography, then you are only allowed to handle general X-ray machines. Then, kung CT scan ka lang. Hindi ka pwedeng CT ka ng morning, tapos sa susunod na araw, nasa X-ray ka or nasa MRI ka. So, very specific yung trabaho or yung scope of practice sa US. So, yun. Okay? So, another minamandate ng batas na ito para magkaroon ng uniform, uniformity sa standard ng mga imaging professionals at mga radiation therapists. Okay? So inuutusan yung secretary ng kanilang Department of Health and Human Services. Okay, so later on makikita natin kung ano yung mga classifications or kailangan na certification para or standard para ikaw ay maging radiographer sa US, maging nuclear medicine technologist. So may iba't iba silang standards. So okay, so yun nga. So the issue why this bill came into being is there is a lack of uniformity sa state licensure and certification requirements for medical imaging and radiation therapy technologies. Bakit may kakulangan ng uniformity? So remember that US is a federal state. Sa bawat state, may kanya-kanya silang batas on how to may kanya-kanyang batas kung ano yung standard, ano yung kailangan na certification requirements for imaging and radiation therapy professionals. So hindi siya pare-parehas. Okay? Kaya nabuo itong act na ito para magkaroon ng uniformity in certification, and in the process of that pagbuo ng standard for the certification and licensure ay yung nagkakaroon ng quality. May improve yung quality of professionals. Okay? So what is needed to update the 1985? This is another law that is updated or that were updated by the CARE Act of 2013. Kasi maraming batas na inamyendahan using that particular legislation. So educational and credential standards. Okay, so ang mga reason ay dahil sa loob pa lang ng 20 years, marami ng pagbabago regarding sa imaging and radiation therapy sciences. And itong mga pagbabago na ito ay kabilang yung mga new technologies, nag-i-improve yung mga machines, diba? From manual processing sa X-ray to automatic processing to digital radiography. So ganun din sa mga ibang modalities such as MRI. Okay, so before, pag sinabi mong MRI, pang-head lang siya. So ngayon, MRI, whole body ay pwede niya ng magawa ng procedure. Okay? So as you can see, may involvement o may tinatawag ditong medical dosimetry. Okay? And also, pasok din dito yung medical physics or physicist. So before, lahat pati medical physics ay trabaho ng RadTech. Diba? Kaya nga pinag-aaralan natin sa radiation biology, sa radiation protection, yung mga different formulas, di ba? HBL, mga half value layer, kasi mga effective dose, mga ganyan. So, kasi trabaho ng RadTech yun before. Though, hindi naman naalis sa atin na dapat alam natin yung pag-compute nun. Pero, sa ngayon, lalo na sa US, bawat hospital ay mayroong mga employed na medical physicist. So dito sa atin sa Pilipinas, usually ang may mga medical physicist lang dito, yung mga malalaking hospitals. Okay? Mga malalaking private hospitals at saka mga malalaking government hospitals. So this is the summary of the CARE Act. So the CARE Act uh, will provide that medical imaging or radiation therapy procedures are performed by a professional with appropriate education and certification or license. Okay, so sa kanila nga rin pala, iba-iba rin ang before itong CARE Act na to, iba-iba yung duration ng kanilang education depending on what particular modality ang iyong pag-aaralan. Yung iba, ano lang months lang. Yung iba, 2 years, yung iba, 1 year. So, depende sa state pa yon. But dahil dito sa CARE Act of 2013, ayun, nagkaroon ng uniformity. At mamaya malalaman natin kung ano-ano ba yung mga organizations na sumuporta dito at bakit nila kailangan suportahan itong batas na to. Okay? So next is practitioners would be required to meet education certification standards determined by certification organization designated by the Department of Health and ano nga to? Ayun, Health and something services. Ayun. So, and obtain state licensure required. So, diba? Kung dito sa atin sa Pilipinas, ang kailangan lang natin is to be able to practice our profession, our bachelor's degree, is to pass the PRC licensure exam. So, doon sa US, before ka mag-take ng licensure exam, kailangan pumasa ka muna at ma-certified ka muna ng mga certification organizations na designated ng kanilang Department of Health. So ano ba example ng organization na sinasabi dyan? One example of this organization ay yung ARRT, yung American Registry of Radiologic Technologies. So, yun. Sila yung nagse-certify ng schools, Okay? Ng programs, ng different programs. Then, sa kanila rin magpapacertify before mag-take ng licensure exam. So, talagang mahirap hindi naman mahirap mag-apply sa US kung manggagaling sa Philippines. Kasi to date, wala pa akong alam na school o project na accredited ng ARRT. Kasi yun, kailangan ang para makapag-certify ka sa ARRT, kailangan yung school na pinag-graduatean mo ay kanilang accredited. And yung accreditation ng school, napakamahal kasi parang umabot siya ng $10,000 ang accreditation pa lang. So, parang wala namang school na maglalabas ng gano'ng kalaking pera, di ba? Kaya karamihan ng mga RadTech sa Pilipinas, di ba, pupunta sila sa Middle East, sa Europe, kasi doon mas maluwag compared sa US when it comes to uh, educational requirement. So, continuation and summary. So, the Act applies to the provider performing medical imaging, planning and delivering radiation therapy. So, yung measuring ng clinical effectiveness ng mga equipment, so kasama sa binibigyan din. Diba? Kaya nga siya ay consistency, accuracy, and ng mga part yan ng mga uh, ng batas. So, advanced training not only to the radiation health workers na professional but also to physicians. Ba? Nagbibigay ng exemption. Okay? So, kaya nga sa US meron din mga radiology nurse. So dito sa atin, usually ang may radiology nurse, yung pa rin malalaking hospitals. Pag sa mga small hospitals, wala silang radiology nurse. Okay. So sa US, may mga radiology nurse. Tapos kung makikita mo dito, may physician assistants. And kasama po sa CARE Act na provide ng standard, yung tinatawag na radiologist assistant. So mamaya tingnan natin ano ba yung kailangan para maging isang radiologist assistant. Okay, so yan, basic lang yan So ano naman yung na benefit ng mga na matatanggap dahil sa pagbasa ng CARE Act? So ensure quality of care. So dahil nga sa nagkaroon na ng standard, pare-parehas na, magiging pare-parehas yung certification, yung education, ba yung licensing. So there will be an improvement of the quality of care na provide ng mga professionals, ng imaging professionals and ng mga radiation therapy professionals. So, ito yung mga reason before. Hanggang ngayon naman, these are some reasons na very kumbaga nakikita pa rin sa practice ng mga RadTech. So some RadTechs, diba, okay na yan, yung mga image na ganyan kahit hindi naman sa quality, may mga ganong RadTech. So poor quality images can lead to misdiagnosis, additional testing. Siyempre, kapag may misdiagnosis, pwedeng magkaroon ng delay in treatment. So, ganun din sa radiation therapy. Pag mali ang computation, mali ang imaging, yung simulation, kasi before you undergo treatment sa radiation therapy, yung pasyente mag-undergo muna ng simulation. The purpose of the simulation para masigurado na ang tatamaan lang ng radiation is yung tumor or yung cancer cells. And usually ito ay kinocompute, sinusukat ng mga medical physicists sa tulong ng images na ma-produce ng RadTech. So kung sablay yung images, poor quality, so sa measurement, maaaring sumablay din. And baka instead na akala ng PCC sa kanyang computation is saktong-sakto sa mga cancer cells, yung pala may mga cancer cells na hindi nahagip ng radiation. So another benefit is improvement of patient safety. So understandable na pag may mga improvement in education and also in standards, so kasama na doon na mag-improve yung patient safety. Bakit? Siyempre, mapag-aaralan ng maayos or maituturo ng maayos yung patient care and safety. At isa sa pangunahin na mga accident sa hospital, kahit naman dito sa Philippines, ay yung tinatawag natin na fall. Diba? Yung bumabagsak ang pasyente sa bed, sa table, etc. So sabi dito sa kanila sa US, numerous injuries and deaths have been attributed to overexposure to radiation during medical procedure. So far, in the Philippines, wala pa namang ganyang study na nakakandak and wala pa ako nababasa or naririnig na there have been numerous injuries and deaths attributed to medical radiation. Okay, so kung ang mga professional ay may standard ng kanilang education and certification, so syempre yung pag-practice ng radiation protection, but the radiation protection principles ng optimization, justification, and dose limits. So kapag alam ng RadTech yun, so they will be able to practice the ALARA principle also para ma-prevent ang unnecessary exposure to radiation ng mga pasyente. So cost saving. So according dito sa US daw ay ang number one na gastos ay yung double exposure or repeat imaging. So di ba tingnan mo laki millions daw ng dollars annually ang nagagastos sa repeat imaging. Okay? So kung maganda yung quality, there's no need to repeat the images. Okay? See? So the CARE Act will reduce healthcare costs by reducing the number of examinations that must be repeated because of improper positioning or poor technique. Okay? So, yan. Kasama sa gagawa ng standard yung kung ang isa bang image ay good quality image, uh, poor quality image, or reject. Okay, so yan. So, naulit lang. Okay. So, the Alliance for Quality Imaging and Radiation Therapy. So, ito yung sinasabi ko kanina na there are organizations that support the CARE Act. And ito nga yung alliance, this composed of 20 organizations na itinatago, the first members of this alliance ay yung ASRT or American Society of Radiologic Technologists and Nuclear Society of Medicine Technology Section. And syempre, nadagdagan ng mga members. Yan. Actually, marami pa yan, pero yan lang yung sinama ko. So, di ba kung makikita nyo may medical dosimetries. So, ano bang mga machine ang hawak ng mga medical dosimetries? So, hawak na yung mga bone densitometer. Okay. Then, ano pa? Pwede rin sila sa radiation therapy, mga dosimetries. Dosimetries sila yung kakalculate ng doses ng radiation. Yan, American Registry for Radiologic Technologies, Association of Educators in Imaging and Radiologic Sciences, Vascular and Interventional Radiographers. So, yan iba yung general radiography sa vascular and interventional radiography. Okay, so general radiography, more on imaging, bones, diba? Or to the use of contrast media, barium particularly. Then vascular, dyan napapasok yung angiography. And of course, mga interventional radiology like arthrography and at iba pa. Okay? So, ito yung standard na pinopose ng Alliance. So, radiographer, kailangan ay mayroong completion ng junior certificate or equivalent radiography program. At may certification and ongoing registration in radiography by ARRT in radiography. So, di ba, very specific. Radiography, so ang pwede mo lang hawakan is X-ray, radiographer. So, ang magiging initial mo ay RT tapos R. Then, next ay yung cardiovascular. interventional or cardiac interventional or vascular interventional radiographer. So, kailangan lang ay ARRT certification and ongoing registration in radiography and yan, cardiovascular, cardiac interventional or vascular interventional radiography. Then radiation therapies. Okay, completion of junior certificate or equivalent ng radiation therapy program and of course certification and ongoing registration in radiation therapy, of course by ARRT. So usually sinusunod na ngayon to date ay yung standards na nilalabas, guidelines and standards na nilalabas ng ARRT pagdating sa mga certification. Okay, so completion naman of a JRC NMT or equivalent nuclear medicine technology program, tapos certification and ongoing registration sa nuclear medicine by ARRT or by the Nuclear Medicine Technologies Certification Board. So, kung mapapansin nyo, very specific talaga sila. Okay? So, yan. Ganun din sa MRI. Okay? So, kung MR sila, so registration or certification ng MR. Okay, so cardiovascular invasive. So yan. So very specific yung mga kanilang certification. Medical dosimetries. Okay. So medical dosimetries, kailangan niya ay sa Medical Dosimetry Certification Board. Medical physicist. So may master's or doctoral degree from accredited college or university in physics, medical physics, biophysics, radiological physics, medical health physics, or equivalent courses making the applicant board eligible. Then, kailangan may 2 years of supervised clinical practice and board certification ng American Board of Radiology. So, ang dami bago siya makapag-practice as medical physicist. So, tingnan nyo naman sa dami ng kailangan ng certification. So, ibig sabihin, yung quality ng professional ay mataas. Diba? Hindi lang isang certification. Then, ito yung sinasabi ko sa inyo kanina na radiologist assistant. So, certification and ongoing registration as a radiographer and radiologist assistant by ARRT. Okay, so, some function ng radiologist ay pwede niyang gawin as a radiologist assistant. Then, sonographer, syempre sa ultrasound. So, yan yung mga certification and programs na required. Then, bone density equipment operator. Okay. So, aside from this, meron pang isang profession doon na included, limited, um, parang limited uh, radiation machine operator or limited X-ray machine operator. So anong trabaho ng uh, professional na yon? So para rin siyang radiographer, general radiographer, pero limited lang siya for uh, non-contrast study. So ang pwede lang niya muna ng X-ray ay chest, abdomen, ribs, spine, pero hindi siya pwede gumamit ng fluoroscopy, hindi siya pwede ng mga contrast study, so mga barium enema, mga uh, esophageography, and upper GI series, so hindi siya pwede. So kaya limited, kasama talaga sa title nung professional na lagay ay limited. Okay? So, ganyan ka-detailed yung gusto mangyari ng CARE Act. Okay? So, yan. Dahil dyan sa didiscuss natin, syempre, dahil siya ay American setting, so, kailangan natin siyang i-relate sa Philippine setting. Kasi ang practice naman natin ay dito sa Pilipinas. Okay, so, yan. Yung tatlong questions, okay? So again, you will be divided into groups and you will be discussing this among yourselves. Okay, so you will be given uh, 1 hour to do it. Okay? So dahil sa 1 hour yung binigay ko sa inyong oras, so hindi lang dapat na ang sagot nyo dyan ay isang sentence, 2 sentence. Yan. So I will be expecting ayun, yung proper output from you. So, lalo na doon sa number 3, di ba? What possible scenarios may come out if such legislation is applied in our setting? Okay? So, before ko i-announce yung groupings, may question ba kayo?